So Justin is an amazing guy. His offices are across the street from Apple's soon-to-be UFO headquarters in Cupertino. I've been there a few times. And he uses electrical stimulation protocols, including the stuff that Jay was talking about in the first 2 days, in order to turn muscles on and to identify things. Like we found, I had this strange thing going on where there was a tiny spot the size of a dime here where I had a nerve turned off, and we zapped it. And he's the guy who diagnosed that when I look up and to the left, these muscles on my body turn off. Very weird stuff, but it has to do with the things we learned about in the last couple of days about how your nervous system turns off certain muscles under certain circumstances to protect you, even though it doesn't actually protect you. So he really helped me with that, but he also knows a ton about supplements and about functional medicine as well. You'll find a Bulletproof vibe and Bulletproof coffee actually in his office, which is really cool. So, Dr. Justin, welcome.
Thanks, Dave. Appreciate it.
I'm wondering, do you have Justin 1.0 and 2.0? Just,
Thanks, Dave. And by the way, I took your advice and did the M-Wave before, so hopefully my talk will reflect that.
All right.
Do I have a clicker?
Yes, we'll get it for you.
Perfect.
All right. Keep the mic with him.
All right, excellent. So again, the title of my talk today is Simple Solutions to Heal Faster and Perform Better. So, overall goal of today's talk really is to kind of bridge the physical medicine side of our health and our metabolic side. And I'm going to try to do that. We're going to go over some complex topics. I'm also going to try to break them down and make them very simple. A mentor of mine always said, if you understand something, you can make it complex, but you can also break it down and make it simple. So any questions, let me know. So again, the foundation of how I look at health is through the triangle of health. So to keep things really simple, we have three main stressors in the body: physical stress, emotional stress, and chemical stress. So for instance, chemical stress could be consuming mycotoxins. It could be infections, food allergens. All of those things combine and cause physical stress or chemical stress. Then we have physical stress, which could be chronic injuries, back pain, too much or too little exercise. And on the emotional stress side, job issues, work issues, relationship issues. And all of these stressors actually go in and affect the DNA. So we know today with the field of epigenetics, we have the ability to turn genes off and on, which is pretty cool. So our overall goal, especially being bulletproof, is really to modulate our genes so we can make our genes smile. That's the overall goal. And we have control over that. Now, if we do not modulate our physical, chemical, and emotional stressors properly, we're going to flip switches off and on, and we're going to make our genes frown. So you guys have the control to turn these genes in the right direction here. And also, all of these stressors interplay on one another. So if you consume some mycotoxins, that's going to cause a viscerosomatic reflex in the gut, and we'll go over that later, which will affect the body's ability to support the spine, which will then cause emotional issues because then maybe you're not able to play with your kid or participate in sport. So all of these stressors interplay. So my job as a chiropractic physician as well as a functional medicine doctor is to be a stress manager. So we have to figure out where stress is coming from so we can pull stressors out of our stress bucket so our body can adapt. So again, we have stressors in three different areas: chemical, physical, and emotional. These could be physical pain, infections, emotional stress, and as we lose our ability to deal with stress, more stressors mount up in our stress bucket. And what we see is a summation effect, so a little then becomes a lot. So we may have a little bit of stress in a lot of different areas that all adds up. And what happens in the conventional medical paradigm, we have bucket dysfunction, meaning an overflow of stress. Our body cannot deal with it, and then we have symptoms. And then what occurs from that, we are given more medications that have inherent side effects, causing mitochondrial dysfunction, and then we're given more drugs for the same issue. So this feedback loop continues to stay in effect. And it's a never-ending cycle, and chronic or persistent problems become chronic issues. So the overall goal really is to come in there, figure out what the stressors are present. Help me out here. Can you put that back on for me? Right,
there we go.
Perfect. So again, the overall goal is to figure out what stressors are present so we can literally go into our stress bucket and pull them out. Hope that's helpful. So moving forward, the healthier our body is, the greater ability our body has to adapt to stress. So as you can see here, this is our healthy person right here. Stress occurs, we go into phase 2, we're able to sleep, eat right, our body repairs, we go from phase 2 right back to phase 1. Not an issue. Now, when chronic stress occurs and we do not address the underlying cause of the stress, we go from phase 1 to phase 2. And then here's where we see our doctor here. And if we do not address that, we continue to go into a phase where we're given a disease name or a diagnosis. So really addressing that stress, pulling that stressor out of there, gives us the best ability to adapt. So this is our health model right now. Here's our ability to have quality of life. So the goal is to have 100% quality of life. And as you can see, as we get older, our quality of life seriously diminishes. So come to about 35, we tend to walk around as a corpse for the last 30 years of our life, and that's not good. So here we have the preventative model, the functional medicine model, where we come in, we address the underlying causes of our health, we manage our stress bucket so we can keep quality of life as high as possible. That's the overarching goal. So working with patients, whether it be on the functional medicine side, because I see many patients with hormonal issues, infertility issues, digestive, depression, fatigue, the foundation of anything, whether it be physical pain or metabolic, is the Bulletproof diet. I love these slides because they also portray a color which elicits an emotion in the right brain. So you're not just reading off a chart, you're also linking that color with the food as well. So with my patients, coaching them, it's not about being perfect all the time, it's about making the best choice. So if green or maybe orange is your best choice that day, well, making an orange choice is a lot better than a red choice, right? So we're not in that perfectionist model, just making the best choices we can possibly make. And this puts our body in an anti-inflammatory state. The more anti-inflammatory we are, the more we put our anabolic hormone pools in a positive direction, which allows our body to heal even from physical injuries. Alright, so again, we're going to get into the brain, how the brain kind of corresponds and is the conductor of this orchestra of muscle contractions, digestive issues, and optimal health. Alright, again, our body, the biggest stress that we are under on a daily basis is gravity. 90% of the brain's input, or the ability going out, is actually to handle gravity. Did you know that? Only 10% of our brain input goes to immune function, memory, learning. Amazing. I never knew that. So the overall goal is we want to affect our body's ability to be efficient at the 90%, so the other 10%, according to immune function and memory and learning, is optimal. That's the essence of biohacking, is to be very efficient at what we're doing. So again, on the physical side, our body's ability to absorb force is very important. So we see the diving board here. The diving board's main purpose is to absorb force and provide an input back to the diver. So the same thing with our body. When we're at listed force, I step forward and land, my body's able to absorb that force in a healthy manner. And when we have issues or maladaptations, injury tends to accumulate. And one of the things that's amazing with the POV and the arc wave is you can actually figure out the areas of dysfunction. And one of the most amazing things is the pain and the area of dysfunction are almost never in the same place. And that's why conventional medicine falls so low in regards to that, because all they're doing is looking at the injury, trying to strengthen that muscle that's injured, trying to inject cortisone or give pain relief to that injured muscle. But the goal is fixing the compensation pattern, fixing the underlying cause, and everything takes care of itself. And as you can see right here, all these contractions tend to occur in a chain. So think of it as like a domino chain. If one domino falls, the next falls, the next falls. If one domino is missing from that chain, the ability of the body to have a healthy contraction is impaired. Again, right here, this is Roger Sperry, Nobel Prize laureate. 90% of the stimulation and nutrition to the brain is by movement of the spine. The other 10% is thinking, metabolism, and immunity. So being more efficient at the 90 allows better efficiency at the 10%. All right. So again, what happens here? The brain is an orchestra conducting chain movement patterns. As I walk forward, I absorb force. I have contraction of my hip flexors, reciprocal inhibition of my glutes. I have relaxation of my hip flexors, contraction of my glutes, and again, my arm goes forward, causing contraction of my upper cervical spine on this side, relaxation this side. So you see a pathway of movement. When we have pain or inhibition signal, what happens? We have a flooding of pain signal to the brain. And over time, a hormonal release called cortisol occurs, which actually can eat up specific areas of the brain, especially in the limbic system. The limbic system is really important for memory and learning. So again, if you're a biohacker, you're in a field that requires higher brain function, we do not want to be in pain. All pain is simply the acronym for pay attention inside now. If you look at the pain, we can address the underlying cause. So the goal is if we put the body in balance, what we're going to see is an increase of this movement to the brain, this communication and movement. That's going to provide a healthy conduction right there. And again, the better movement signal, the better you're going to look, feel, and perform. Alright, I'm going to get a little complicated at first, and then I'll break it down and make it real simple. So if you get that glossed over look, just hang in there. I'll make it simple. Alright, so right we have our muscle spindle. We have our alpha motor neuron. We have our Golgi tendon, which is our gamma motor neuron. So Jane talked about on Thursday these alpha and gamma motor neuron loops. So we'll touch base on that so you get it. This is a transverse cross-sectional cut of these muscle fibers right here. So what is happening when a muscle contracts is we have a depolarization of this negative charge through our sodium and potassium pumps that allows that charge that's negative to get more positive. What happens there is an influx of calcium, which allows actin-myosin cross-bridging to occur, which allows contraction. As I stop and absorb force, we have what's called an eccentric contraction. The actin and myosin cross-bridging relax because ATP comes in there and lets it go. So really simple. Muscle contracts. Concentric. Muscle absorbs force. Eccentric. Really simple. And for the muscle to relax and to absorb force, it needs nutrition, it needs oxygen, it needs ATP. What happens when someone dies? Rigor mortis. You ever had a pet and you pick them up after they pass? They're really stiff because you need that activation, you need contractions for muscle to relax. So what happens? Force comes in, the muscle absorbs force, we have a healthy contraction. When injury occurs, force is absorbed, not properly, and it goes into other sensitive structures of the body like discs, tendons, and ligaments. These sources are avascular in nature, meaning they don't have the blood flow. So the ability for them to heal is significantly impaired. And that's where functional neurology and POV can be very helpful because we can increase that blood flow, we can increase oxygen to essentially increase healing by about 80%. So now over time, this is the chronic injury. Force goes in, injury. We create a compensation pattern. I hurt my hip. This is the compensation pattern my body is using to absorb force. Okay? And over time, it may look a little better, but there may be something on a subclinical level that's still there. Force is not being absorbed properly. What we see is the ability for this muscle to create a negative charge and depolarize is inhibited. We're seeing all this inflammation here. So how the arc wave and the POV works on a biochemical level, it's sensing this inflammation. Essentially, the brain is creating a biofeedback loop because you're feeling pain when you, what's called search and destroy on the ARP or POV. You can find these areas of dysfunction and then eventually heal them about 90% faster.